Hello everyone. Today we will talk about wound care. Wound care it is a process of assessing and cleansing the wounds, performing dressing change, and implementing intervention to promote healing. So, how do you take care of the wound, or what is the steps of wound care management? The first step in wound care management, assessment of the wound. Assessment of the wound, it is very important and initial step in wound care management. So it is very important to note location, size, depth, and type of the wound because type of treatment differs according to type of the wound. Okay, hand washing, it is the next step in wound care management. So it is very important to procedure after and before any process. So thoroughly wash your hand with use soap and water. Rub your hands, then rinse your hands. Dry your hands by use a clean towel. Then wear a clean gloves. Then stop the bleeding. To stop the bleeding, apply pressure to the wound by use bandage or a clean clothes. Then elevate the wound area above the heart level to decrease blood flow to this area. Wound cleansing. Irrigation of the wound with normal saline should be carried out after each dressing change. And we prefer use the normal saline rather than antiseptic because it is isotonic solution and will not further damage of the tissue. And we can use running water at least 5 minutes to remove any dirt. So then dry wound area by use clean towel. Skin closure. It is often necessary to close gaping skin wounds to hasten wound healing and prevent unsightly scars. So this is the common method to close the skin. Sutures are knotted ties that hold incision together. Straps, glue, staples. Staples, it is the wide metal clips. Dressing of the wound, it is very important to keep the wound clean and other purpose for this. There are some types of dressing like hydrocolloid dressing to keep the wound moist and gauze dressing and transparent dressing to allow assessment of the wound without remove the dressing. So purpose of dressing: to promote wound healing, to prevent infection, to holding medication in place and absorb drainage. Nutritional support. Food should be rich in antioxidants, vitamins, and bioflavonoids. Adjunct therapy include hyperbaric oxygen therapy, negative pressure wound therapy, and electrotherapy. After this, changing the dressing. The dressing should be changed at least once a day. When changing the dressing, make sure wash your hand and while changing the dressing, evaluate the healing process and if it presents yellowish discharge or appears dark red in color, these are signs of abnormal wound healing. Other steps in wound care management: tissue perfusion and moisture control in wound environment by avoidance of occlusive dressing and bandages near the wound site, and appropriate and adequate analgesia. Wound healing can be associated with a significant amount of pain, so it's very important to give the patient analgesia. So it is the steps of wound care management. If you have any questions, please write in the comments box.